With the opioid abuse, neglect, or opioid, epidemic and addiction, alcohol, other drug abuse, and methamphetamine, we have seen an explosion of scenarios where our children are put at significant risk and the county has had to intervene in some way.
The Wisconsin Department of Children and Families estimates more than 80% of open child welfare cases are either driven by or complicated by drug and alcohol abuse.
Our last great drug epidemic in the 1980s, the crack epidemic, you also often associated with urban areas. This is a drug epidemic that's hit rural as hard as urban areas. You guess an example of that in our region, Clark County, in 2014, 8% of their CPS cases was driven by drug abuse. In 2017, that was 88%. The increase in terms of county costs for out-of-home care placements, because some of these children in unsafe situations are placed in a foster home, in a group home, in a residential home, and the county bears the burden of that cost to provide for those children. And those costs have skyrocketed in recent years.
With these numbers, the increases in out-of-home care was a tremendous strain on the on those foster care resources. We're also seeing larger sibling groups come in to our system, and so if we can't support them in a single home, we talk about the impact on kids of separating sibling groups and having to put them in different foster homes. The other thing that really comes to mind is the impact on the case workers themselves. So the caseload burden, the number of cases that they're required to carry, and not just the cases, but the number of children, what that adds up to over a total caseload. So the workload burden on them is tremendous.